You bought it because it said safe. You handed it to your pet because the packaging promised durability. Dental health. Vet approved. Natural materials. Let me ask you something. If the toy sitting in your living room right now was slowly cracking your pet teeth, would you even know? Because here's the shocking truth experts warn about, and most companies don't highlight. Some of the most popular, healthy, pet toys are causing silent damage. They look fine. Your pet looks fine. Until the silent phase begins. And by the time you notice, it's often already irreversible. Today we're exposing the hidden dangers behind common chew toys, the ones trusted in millions of homes. And the next one we're revealing. Some clinics refuse to recommend it at all. But first, we need to talk about trust. The marketing illusion. Walk into any pet store. What do you see? Bright colors. Happy dogs. Smiling owners. Buzzwords like dental strengthening, long-lasting, tough chewer, vet approved. It feels safe. It feels responsible. It feels like you're doing the right thing. But here's what they don't want you to think about. Durable often means hard. And when it comes to teeth, hard can mean destructive. Veterinary dentists have repeated one core warning for years. If a toy is harder than your pet's tooth enamel, it can cause fractures. But most owners never test that. We assume if it's sold in stores, it must be safe. That assumption, it's false safety. And false safety is dangerous. So let's break down the first silent offender. Toy 1 hard nylon bones. You've seen them. Solid, rigid, marketed as indestructible, often labeled as promoting dental health. Why people trust it? It lasts forever. It keeps pets busy. It doesn't break apart easily. It looks professional and vet grade. But here the hidden problem. Tooth enamel is strong but not invincible. When a pet chews repeatedly on an extremely hard surface, tiny stress fractures can begin. Not dramatic cracks. Microfractures. Small, invisible damage to enamel. And here's the terrifying part. Pets don't scream when this happens. They keep chewing. Because instinct tells them not to show weakness. Over time, those microfractures can deepen, eventually exposing dentin, then nerve tissue. That's when severe pain begins. But the silent phase, that started months earlier. Experts warn that slab fractures of the large upper premolars are among the most common dental injuries in heavy chewers. And guess what's often in the home? Rigid nylon chew toys. This mistake costs people thousands every year in extractions, root canals and dental surgery. And most owners had no idea the toy played a role. So what's safer? Flexible rubber toys that bend under pressure. Toys you can slightly indent with your fingernail. If it feels like rock, it must be avoided. But that's not the worst one. Here's the next. Toy 2 real animal bones, cooked or raw. This one shocks people. Because it feels natural. Primitive. Healthy. Instinct-driven. Dogs have chewed bones forever. That's the argument. And it sounds logical. Until you look at veterinary data. Cooked bones become brittle. They splinter. They crack teeth. Raw bones. Still extremely hard. Still capable of causing fractures. Why people trust it? It feels ancestral. It's marketed as species appropriate. It's often recommended in online forums. But hear what experts warn. Teeth break on hard bones more often than many owners realize. The damage isn't always immediate. Sometimes it's a slow crack. A stress point that deepens with time, And because pets keep chewing happily, we assume everything's fine. Until one day, they stop chewing on that side. They hesitate before eating. They drool slightly. By then, the silent phase has ended. The pain phase has begun. And infections can follow. Tooth fractures expose pulp. Exposed pulp invites bacteria. Bacteria lead to abscesses. Abscesses lead to systemic stress. This isn't dramatic exaggeration. It's a biological chain reaction. So ask yourself, is the risk worth it? There's a safer approach we'll reveal in part 4. But first, we need to talk about something even more common. And almost nobody questions it. Toy 3 hard plastic balls. They look harmless, bright, smooth, entertaining. They roll. They bounce. They keep pets active. Why would that be dangerous? Here's why. When a dog grips a rigid plastic ball repeatedly, especially during fetch, teeth collide with a surface that does not give. Repeated impact, repeated stress. Over months or years that stress compounds. Experts warn that chronic chewing on rigid balls can wear down enamel, flatten teeth, cause surface fractures. But here's the trick. It doesn't happen overnight, which makes it harder to connect cause and effect. Owners don't remember that ball from 2 years ago. They just see a dental bill today. This is where most owners get it wrong. They look for immediate injury. Dental damage is often cumulative, silent, building, and by the time sensitivity appears, the structure is already compromised. Now here's the cliffhanger. There is one category of toy that some veterinary clinics refuse to recommend entirely. Not because it's unpopular, but because the injury rate is too high. And if your pet loves heavy chewing, this next one is critical, because it's marketed as natural, and that word alone has misled millions. We expose it in part 2. Clapperboard part 2 damage that builds over time. Before we continue, look at your pet right now. Are they chewing something hard? Are they gripping it proudly, happily, confidently? They look fine. That's the trap. Because dental damage rarely begins with screaming pain. It begins with pressure. Repeated pressure. And experts warn that this next toy category is responsible for a shocking number of fractures. And most owners never connect the dots. Toy 4 antlers. Deer antlers. Elk antlers is natural, long-lasting, premium chew. They're sold at high prices, often in boutique pet stores, sometimes even labeled as healthier alternatives to bones. Let me ask you something. Have you ever held one? They're rock hard, denser than most natural bones. And that's exactly the problem. Veterinary dentists frequently report slab fractures linked to antler chewing. Not because they splinter, but because they don't give. When a tooth meets a surface that refuses to compress, the tooth absorbs the force, and enamel, while strong, has limits. Micro-fractures begin. Tiny cracks invisible to you, invisible to your pet behavior. But over time, those cracks deepen. This is where most owners get it wrong. They assume durability equals safety. But durability often means excessive hardness. And excessive hardness equals risk. Now here's the part they don't advertise. Many heavy chewers who use antlers regularly eventually require dental extractions. Which means anesthesia, X-rays, surgery, pain medication, and bills that can reach thousands, all from something marketed as natural. This mistake costs people thousands every year. And the silent phase. It started the first week they chewed it. But we're not done. Because the next one is even more common. Toy 5 tennis balls. This one surprises almost everyone. Tennis balls look soft, harmless, playful, safe. But here the hidden danger. Tennis ball felt is abrasive. Over time, especially with aggressive chewers, that felt acts like sandpaper on teeth. Experts warn that repeated grinding on tennis balls can wear enamel down gradually. Not dramatically. Gradually. Teeth flatten. Surfaces thin. Sensitivity increases. But pets don't announce sensitivity immediately. They adjust. They chew less on one side. They avoid pressure. They keep playing. And you assume it's just fetch. Now here's the shock. When enamel thins enough, the inner layers of the tooth become vulnerable. That's when nerve exposure can begin. And nerve exposure is not mild discomfort. It's intense. But pets still hide it. They hide nerve pain instinctively, which means the silent phase can last far longer than you think. And when symptoms finally appear, it may require extraction. Let me ask you directly. Has your pet played fetch for years with the same type of ball? Have you ever considered enamel wear? Most people haven't. Because it looks harmless. False safety again. And we're only halfway through. The microfracture reality. Let's break something down clearly. Tooth fractures don't always explode dramatically. They often begin as microscopic cracks in enamel. These cracks aren't visible without magnification. Don't cause instant behavior chain. Don't bleed. Don't scream. But every chew adds stress. Every bite deepens the weakness. Until one day, the fracture extends into dentin, then pulp, then infection. And here's the biological chain reaction. Exposed pulp, right arrow, bacterial invasion, right arrow, inflammation, right arrow, abscess, right arrow, systemic stress. Silent damage becomes visible damage. And by then, you're not preventing anymore. You're repairing. This is where fear meets reality. But I promised clarity, not panic. So let's keep exposing the truth. Because the next category is the most controversial of all. And if your pet chews this daily, Part 3 is critical. Clapperboard Part 3, the toys experts beg you to stop using. Some toys aren't just risky. They're repeatedly flagged in veterinary discussions. Yet they're still sold everywhere. Why? Because they sell. Because they're profitable. Because injury doesn't happen immediately. And because most owners never trace the damage back to the product. Let's talk about it. Toy 6 hooves. Cow hooves are marketed as long-lasting, protein-rich chews. They look rustic, natural, traditional, but they're extremely hard. And unlike softer digestible chews, they resist compression. Experts warn that hooves can crack molars under heavy pressure. But here what makes them especially deceptive. They don't break down quickly. Which means repeated exposure. Repeated force. Repeated micro-trauma. Over weeks. Over months. Silent damage accumulates. And because hooves are common in pet aisles, owners assume they're approved by default. But store availability does not equal medical endorsement. Let that sink in. Now here's the next. Toy 7, hard yak cheese chews when too dense. These exploded in popularity. High proteins. Long-lasting. Natural milk-based chew. But density varies dramatically by brand. Some are flexible and soften with saliva. Others remain extremely hard. And when overly dense, the same risk pattern appears. Force, resistance, enamel stress, fractures. This is why experts emphasize testing hardness. If you cannot slightly indent it with your fingernail, it may be too hard. Not all are dangerous, but improperly chosen ones can be. This is where nuance matters. Not all products are evil, but misuse and misunderstanding create risk. And here's the myth we need to destroy. The vet-approved label illusion. Have you noticed this phrase? Vet recommended. Vet approved. Designed with veterinarians. Sounds reassuring. But here's the uncomfortable truth. That label does not mean zero fracture risk, zero enamel wear, zero injury history. It often means general safety guidelines met, not individualized suitability. A toy that's fine for a light chewer may be destructive for a power chewer. But packaging doesn't evaluate your pet. You do. Which is why education matters more than marketing. And here's the emotional reality. Many owners feel guilt after a dental injury. They think, I should have known. But they weren't told clearly. Now you are. And the final part. It's about control. Because you are not helpless. And prevention is simpler than you think. Let's build that framework. Clapperboard Part 4, How to Protect Your Pet Starting Today. Take a breath. Awareness without action creates anxiety. Action creates power. So here's the clear framework experts use. Step 1, the hardness test. Rule of thumb. If you wouldn't want it thrown hard at your knee, it's likely too hard for teeth. Better test it. Can you indent it slightly with your fingernail? If no, right arrow, high fracture risk. This single test eliminates many hidden dangers. Step 2, choose flexible materials. Look for rubber that bends, soft nylon blends, supervised edible chews that soften with saliva. Avoid at all costs extremely rigid materials, rock-hard natural products, toys marketed as indestructible. Indestructible often means tooth-destructing. Step 3, rotate and replace. Worn toys can develop sharp edges. Inspect weekly. Replace if cracked, splintered, excessively rough. Dental protection isn't one-time. It's ongoing. Step 4, watch early dental warning signs. Subtle drooling. Chewing on one side. Avoiding hard treats. Bad breath. Reluctance to play tug. These are early signals. Not dramatic ones. If you catch them early, you prevent escalation. Rapid recap, must avoid. Extremely hard nylon bones. Antlers. Hooves. Overly dense cheese chews. Rigid plastic balls. Excessive tennis ball grinding. These aren't guaranteed disasters, but they carry higher risk. And now you know why. They look fine. Your pet looks fine. Until the silent phase begins. And the silent phase, it starts with micro damage. Not drama. But now you're ahead of it. So let me ask you, which one shocked you the most? Have you unknowingly used any of these? Comment below. Your experience might protect someone else's pet. Subscribe before the next hidden danger harms your pet. And watch this next. Because what you feed your pet may be worse than these toys. Protection isn't about fear. It's about knowing what others overlook. Now you know. And that changes everything.